So this patient actually has been placed on fluids. You can see they have the bandage on, the fluids are going directly into their leg. And as our job of veterinary nurses, these patients require very close monitoring because, a bit like giving any veterinary medicine, anything can go wrong, and we are giving this medicine continually. So close monitoring is advised. So first thing we want to make sure, because this fluid is a lot colder than what is out inside the body. So inside the dog's body is about 38 to 38.5 degrees, and this bag of fluids is at room temperature, which is probably a good 10 to even 20 degrees cooler. So that means that we're putting something very cold into the patient's vein, which could put them at risk of hypothermia, so being too cold. So things that we can do, we can actively heat these fluids. We never put them in a microwave because it can just destroy all the electrolytes. What we can do is get something called a fluid warmer, which is an electrical device that will wrap around the giving set, so heat the fluids in the giving set, meaning that it can be a little bit warmer to the patient. Other things we can do are provide active heating, so we can put the patients on heat pads, give them blankets, but we need to take their temperature quite regularly. So with a thermometer into their rectum, obviously using lubricant and having someone to restrain, and we're going to take their temperature to make sure that they're not getting too cold. Particularly if they're feeling unwell, they might not want to move too much, and that means they're not generating heat through movement, so they are at risk of getting quite cold quite quickly. The second thing that we're going to monitor is the actual IV site. So I said earlier that cannulas can become dislodged or blocked. So if a cannula becomes blocked, maybe a blood clot, maybe it's actually come out of the vein, the fluids will stop running. So we can do a number of things to assess this. First of all, I'd remove this bandage because it might be that the bandage is too tight and acting as a tourniquet on the fluids. The next thing I'm going to do is take some sterile saline and flush the cannula, so using the port which is here, or disconnect this giving set and flush it directly through the cannula and check the cannula's patent. If it is blocked, I am going to have to replace it. There's no point trying to flush it with something that will dissolve a blood clot because that can be quite dangerous, particularly in small animals such as cats or small dogs. So I would just replace it. Every day I'm going to change this dressing at least twice, so once in the morning, once in the afternoon, and I'm going to look at the cannula site. So I'm checking that there's no redness, no swelling, there's not swelling above or below where I've placed my cannula, so there's not a edema forming here or here, because that could indicate that A, again, the bandage is too tight, or B, the cannula has become dislodged and fluid is actually accumulating under the patient's skin. But I want to make sure that there's no sign of infection in the leg here, that everything is dry, everything is clean. If the bandage gets dirty or wet, I'm obviously going to replace that immediately because I don't want any source of infection in my IV line. I am going to also be checking the patient's heart rate and rest rate quite regularly as well, because I want to make sure that their blood pressure isn't too high or too low. So I could use a blood pressure monitor if I've got one, which would be fantastic, but I want to make sure that their heart rate is in that normal region of somewhere between 60 to 100 beats per minute, and their respiratory rate is less than 30 beats per minute. The other thing that we have to be really, really careful of is something called fluid overload. So this dog's not especially big, and to be completely honest, if this dog was, say, 10 kilos, this bag of fluid would pretty much be their entire blood volume. It's really not too much. So if I'm putting an extra 500 ml of fluid into a patient that doesn't need it, that fluid has got nowhere to go. And as you know from A&P, veins, capillaries and arteries, they're not permeable. Water can move through, liquid and fluid can move through osmosis. So if we have an excess of fluid in the veins, the capillaries, the arteries, that fluid is going to start to seep out into other areas, and it can build up around the lungs, it can build up around the sac around the heart, the pericardium, it can build up in the abdomen, and all of this can make the patient very, very uncomfortable. It can be very difficult for them to breathe properly, and in worst case scenarios, it can put them into some really dangerous circumstances, such as cardiac failure or respiratory failure. So I'm going to be checking their respiratory rate, making sure it's less than 30, and I'm going to be checking everywhere for any signs of swelling. I'm going to be checking their blood pressure. I'm going to be making sure that the rate of the fluids as well is set at what the vet has prescribed. So I can do that by either watching the fluids. So I'm just going to run these for you. I'm just going to show you how they drip through. So you can see it drips there. So if the vet has said that they want them on twice maintenance, I would calculate that, and we'll do some maths on how to calculate that. And I would then check, counting over a minute, how many drops go through that little chamber there. And I would make sure that that tallies up with what my maths says. Or most easily, I could use something called a fluid pump, which I could attach to the drip stand, which is this metal stand here. It's a mechanical device. I would put in how much fluid I'd like to deliver over an hour or over a certain time period, and then I would just check that that's working. They do make life easier, and they do mean that, particularly for small patients that are really vulnerable to fluid overload, that we're doing it in a much safer, much more controlled manner. So if there is one available, always use it. Other things I'm going to be checking, obviously, are just the mucous membranes of the patient, making sure they're good and pink. As I say, their heart rate, their rest rate, their respiratory effort. One thing I can do as well is listen to their lung fields. So that means I would put my stethoscope, rather than listening to their heart here, I would listen to here, under the side of the chest, and listen to all 4 lung fields, so front, side, and back, and listen for any crackles. If it sounds a bit like you've poured milk over Rice Krispies, or that you've got, I can't remember the name of the sweets, but you pour them on the tongue and they crackle. If it sounds like it's crackling, that is a very strong indication that there is fluid building up in regions that there should not be fluid. And if any worries, anything you're not happy with, I would stop my fluid and I would get a veterinary surgeon as soon as possible.